The big news today is that throughout all of California, if you're 50 or older, you can get a COVID shot.
No need to have any pre-existing condition, no medical underlying condition that would qualify you. As long as you're 50, you're good to go. And this comes as the nation now is seeing a growing number of positive cases, a fourth surge of the virus. So getting a vaccine, all the more important.
And there are supply problems, so we're thinking that might get worse. Let's go to the new developments and ask some questions from UC Berkeley infectious disease expert Dr. John Swartzberg and get some answers, more importantly. Hello, doctor.
Good morning.
So this is going to be a game changer because finally it doesn't matter if you're a first responder or what your job is. And people 50 and older are typically out there about traveling, they're employed. Talk about how we might see the state change starting today.
Well, we're going to have 5.5 more people eligible starting today, which is really wonderful. As everybody knows, we're in a race with these variants and we need to get as many people vaccinated as possible. And right now, the group of people that are really at highest risk for transmitting the virus are young, healthy people. So we've got to get that vaccine in people's arms as quickly as possible. The dilemma, of course, is how. We know the what. We know what we want to do. It's just a question of how we can do it.
Oh, you're saying because if 5.5 million people suddenly today are eligible,
right,
we don't have enough shots for that.
It doesn't look like it. When you say we, here in the Bay Area, it really doesn't look like it. You know, it's been really interesting following this saga since mid-December when these vaccines, Pfizer and Moderna, got approved. Either there were problems with the logistics, that is, there weren't enough sites set up or not enough people to give the jabs, or not enough syringes or problems along that line. Or when the logistics finally get ironed out, the pipeline's a problem. And it's been going back and forth, logistics, pipeline. The pipeline of getting enough vaccine to these places to get it in people's arms. So right now where we are is, I think we've done a really good job here in the Bay Area and actually nationally in working out the logistics of making sure that all the sites are available and enough people are there to give the shots. But the pipeline's now the problem.
I was going to say, you bring up the vaccination sites. I mean, that's the other big story we're following this morning, too, is the fact that the Oakland Coliseum is scheduled to be shut down as a mass vaccination site on April 11th. Local health officials obviously pleading with state and federal officials maybe to keep it going, given that, you know, there's a surge.
Given that that's right when kids 16 and older can start getting shots.
So from a policy standpoint, I mean, they have to reconsider that, right?
It sounds like it. You know, it doesn't do any good to have these sites open if you don't have any vaccine. And we've seen several sites that are available to give the vaccine just having to close because there's no vaccine right now, or there's not enough vaccine right now. You know, we're talking about the bad news. The good news is that we know how to deliver these vaccines and we know how to produce them. But right now, things are just not in sync. And it's going to cause a great deal of frustration for the next 2 weeks and probably another week or two after that. So the month of April could be, we could see two things. On the bad side, we could see a lot of people frustrated because there's not enough vaccine to get into people's arms. On the other hand, nationally, we're going to be pumping a lot of vaccine every day into people, like about 3 million people a day probably.
Right.
So ultimately, we're going to get there, but April could be a frustrating month for a lot of people.
Well put, right. So like, I'm allowed, I'm 50, but I can't get a shot. And then you add to that the J&J problem, which is good news, bad news too, because it's actually good that there are, you know, systems in place and they say, oh, this is mixed wrong, we're not sending it out. And so they caught it, but now, of course, we don't get all those doses.
Right, like about 15 million. And remember, 15 million doses of J&J represents 15 million people fully vaccinated because it's only one jab. So it's you know, it's a setback. The last time the three of us talked, you know, I said, well, you know, if things go well, if the stars are aligned, but stars aren't quite aligned right yet.
I'm curious, what can you say to viewers out there watching who might see this story about Johnson & Johnson and this batch that they're going to have to destroy and point to that and say, see, this is what I'm talking about. This is why I don't want to get the shot. We don't know what's in there.
They didn't send it out.
Right. So what can you say to alleviate the minds of people who are skeptical when they see headlines like this?
Yeah, that error that was made by a subsidiary of Johnson & Johnson that's producing the viral vector for these vaccines, that error was caught well before anything left the door of Johnson & Johnson. So the quality assurance systems are in place and they do work. And I think that's the good news, that the systems we have in place to make sure that nothing goes wrong in terms of that vaccine being administered to people. So I'm very comforted by that. I'm disquieted by the fact that this really human error and simple error could have been made on such a massive scale when it's so critical. Yeah. That's a real black eye for that company that's working with Johnson & Johnson and Johnson & Johnson itself. But from the public standpoint, that's why we have quality assurance systems, and it worked very well.
And thank you, doctor. I mean, your point is well taken as far as the safety, that it is safe. It's too bad there's not a lot of supply. But again, like you and all the other doctors say, 50 and older starting today. And when you can sign up, sign up. Even if you can't get the shot tomorrow, just get in there as soon as you can.
I agree with you 100%.
Repeating your words. Thanks,
Thank
Doc.
you very much.
Thank you.
We'll be right back.